Hello, my name is Allison and I'm a student nurse practitioner with Old Dominion University. Today I'm going to be going over some information with you about asthma so that you can understand what happens when you have an asthma attack and what to do to help it. When you breathe, the air travels in through your trachea or your windpipe into your lungs. Inside your lungs, there are little branches called bronchioles that the air travels through to get to the alveoli, which look like a little cluster of grapes. Here, you can see a bigger picture of the bronchiole with the alveoli there at the end. Inside the alveoli, oxygen is taken from the air that you breathe in and put into the blood to be sent to the rest of your body. At the same time, carbon dioxide is taken out of the blood for you to breathe out. When you have asthma, your bronchioles are more sensitive and tend to overreact when something bothers them. When something triggers your asthma, like a cold or allergies, your body produces chemicals that cause swelling and mucus buildup inside your bronchioles. It also causes the muscles around your airway to tighten. This makes your trachea and your bronchioles much more narrow than they normally are, which makes it more difficult for the air to travel in and out of your lungs when you breathe. Here, you can see the difference between a bronchiole before an asthma attack and during an asthma attack. Before the asthma attack, you can see how relaxed these muscles are. There's no extra mucus in there, and the bronchiole is wide open, easy for the air to travel in and out. Here, during an asthma attack, you can see the swelling inside the bronchiole. You can see all the extra mucus built up, and you can see how tight these muscles are. This is what makes it more difficult for you to breathe or make you feel like you can't catch your breath. This is what makes you wheeze or sound squeaky because the air is meeting more resistance when it travels in and out of your lungs. And you may cough more because your body is trying to get rid of all of that extra mucus. Luckily, these changes are reversible and asthma is easily treatable. The two most common medications that we use for asthma are called controller medications and rescue medications. Controller medications are medications that you take every day to help prevent an asthma attack. It can be an inhaler, a pill, or both. The inhaler is a type of medication called a corticosteroid that works to prevent swelling in your airway. It can also help limit the amount of mucus that is produced. The pill is called a leukotriene modifier, which is a big word, but all that means is that it prevents your body from making the chemicals that cause the swelling. These two medications work together to help prevent asthma attacks by keeping your airway open. It is important that you take these two medications every day, and even when you are feeling okay and not having any trouble breathing. That means that they are working. A rescue medication is a medication that you take when you are having an asthma attack to stop it. The most common type of rescue medication is called albuterol, which is a bronchodilator. That's another big word, but bronchodilate just means that it dilates or opens up the bronchioles. Albuterol does this by relaxing the muscles around the airway. Albuterol can make you feel jittery or shaky. It can make your heart race, so don't be worried if that happens to you. It should go away within a few hours. When you are sick, you may also be prescribed a corticosteroid in pill form instead of the inhaler that you take every day. The pill is a stronger form of the corticosteroid and can prevent you from having any asthma attacks that may be triggered by the cold. I know this is a lot of information that we just went over, so I will be sending you home with an asthma action plan that outlines when and how much of each medication to take. I know it's not always possible to do this, but it is important to try to avoid the triggers for your asthma. Things that can trigger your asthma can be exercising in the cold, scented perfumes and soaps, or cigarette smoke. If you're able to limit being around things that irritate your bronchioles, they will not overreact as often, you will feel better, and you'll have fewer asthma attacks. I have printed out some resources that go over the information that we talked about today that you can bring home. There's also one in there about how to properly use an inhaler, and it's important for you to review that. I've created a follow-up appointment for you in 2 weeks. If you have any questions, please feel free to call me before then. If not, I'll see you then. Have a good day.